Good morning and welcome to the closing ceremony of the 16th edition of MilanMUN. The conference has almost come to an end, and we hope that you've had a fruitful debate throughout these 3 days.
Before moving on to our chair's final speeches, the president of the school board wants to say a few words. Ms. Sumerano, the floor is yours.
Thank you very much. So good morning and good afternoon to all of you according to the different time zones. And it's a pleasure and an honor to be here, of course. In my 3-minute speech, I would like to be helped by 3 items. The first one is the one behind me, this one. You see, the world map. I think that nothing like this pandemic situation, which has been also one of the main topics of this conference, has made us feel like a unique big country, sharing the same fears and the same hope all over the world. And at the end of the day, I think that this is what the MUN educates our students to. So to consider the world as a unique entity and trying to find shared solution for common issues and challenges. So this is the MUN, and this is what actually we need. So and the second item I brought is you see, a flower because I would like to thank you. To thank you, first of all, our headmistress, Mrs. Maria Rossi, for her wise supervision of this event and on our school daily. Then the town councillor, of course, for education, Mrs. Laura Galimberti, for her support to the initiative. And of course, a big thank you to our MUN advisors, so Mrs. Fernanda Imperiale, Mrs. Atena Longo, and Mr. Jacopo Campedel for their dedication to our students throughout the year, and of course for this big event. Thank you also to our keynote speaker, Greenpeace and FAI. During the first day, they gave us some inspirational messages. But believe me, the most heartfelt thank you goes to all chairs and all delegates, because despite the situation and the constraints to run all our activities online, you are here with passion, with motivation, and really a big thank you. This is a big message for our school, all schools, and all our adults community, really, believe me. So really thanks a lot to all of you. And my last item is, you see, a passport. A passport, because I really hope that next year, all of you, all of us, can take it out from our drawers and use it all over the world. So thanks again, and all the best to all of you.
Thank you, President, for your kind words. Now with us, we have a member of Emergency, Francesca Bocchini. She graduated in Political Science, International Relations, and Human Rights, and specialized in Migration Studies. Before entering a position at Emergency, she was an intern at UNHCR in the Dominican Republic. Her main field is on the topic of migration and has carried out survey missions in Greece and has set up a migration health project, which was later suspended due to COVID-19 pandemic. She's now the project manager of the Emergency COVID team. We yield the floor to Ms. Francesca Bocchini.
Hello, everyone. Thank you for the presentation and for the invitation. Can you hear me well? Not if you do, okay, thank you. I prepared a couple of slides I'm gonna show, if I can. Okay. I cannot see you now, but if you have some questions, please interrupt me. So I've been given the very difficult task to describe what was the impact of COVID-19 on healthcare systems. So I'm gonna start with a map, as actually the professor just mentioned, because I think there is no matter where you come from, there was no country that has been left out of this outbreak. So I think it was a very important lesson learned this year, that healthcare is not an individual right, but is also a collective right. So we are also responsible for the health of others. So I assume not every one of you knows emergency. So emergency, just in a sentence, is a humanitarian organization that provides medical and surgical care to those who need in different countries around the world. We also work in Italy. And of course, as a medical organization, we have been asked to intervene to help during this outbreak. What was the impact? So I'm pretty sure you're very much familiar with many of the things I'm going to say, but just to sum up. First, the pressure on hospitals and intensive care units. Intensive care units are those departments in hospitals where the most severe patients are taken care for. So what did we decide to do, and what were we asked to do? First, increase the bed capacity in some COVID-19 facilities in Italy. So we worked in Bergamo during the first wave. For those who are not Italian, Bergamo was one of the most severely hit cities in Italy. And then we did it also in Crotone. Of course, the more beds you have, the more you can provide the critical care to most severe patients. So this was the first step. But of course, something that has been pretty much neglected in the, let's say, the general debate was the uninterrupted provision of essential care services. I'm pretty sure that among you, among your families, some people needed, had needed care in this year. And these services cannot stop from one day to another. This is because on the slide I wrote, people have not stopped being sick for reasons other than COVID-19. In this picture, I decided to show you a maternity center because I think it's the most natural things that can still happen, so mothers giving birth. And it's very important then to ease the pressure on hospitals that are dedicated to COVID-19 to continue providing other essential care services. But how did we do that, and how do you do it? You have to protect the staff and the patients inside the hospitals. You have been asked to respect many preventive measures, actually pretty simple, but still, the distance, washing hands, wearing the surgical mask, and so on. In a hospital, of course, which is very kind of critical environment, and normally hygiene rules and measures are already high in, let's say, ordinary times. We had to, of course, implement many measures. Of course, in here you can see very simple ones of temperature taken. On the left, you see Sierra Leone, on the right, Sudan, but also a lot of cleaning rules. For example, you can see on a door, like the surfaces you touch the most are the most critical. And we developed protocols, the so-called infection prevention and control protocols, to protect our staff. I'm not going to go into details because it's be kind of boring, but of course you have to create flows for patients, for staff, for materials, for the garbage you have to throw away, contaminated materials. And based also on the experience we had with Ebola in Sierra Leone in 2013 and 2015, we developed a COVID-19 response plan that was then adapted, of course, to other hospitals that we run, and they were also actually presented and promoted to other hospitals in Europe as a model. And we're actually in Sierra Leone, that was, of course, pretty sensitive in the topic, was endorsed as a model by the Ministry of Health. But what we have also learned is that the impact of COVID-19 does not stay focused on hospitals only, but also on society in general. So we could not focus all our energies only on hospitals. But as a medical organization, we had, let's say, the responsibility to spread the messages of prevention, of protection, and inform people of what was happening. So I'm pretty sure that you have been bombed by information about what's happening. Probably you have been overwhelmed by data, by studies and different perspectives on vaccines, I'm sure. What we did in the first place was to create and develop some messages also in other languages for other communities that otherwise could have been left out by the media, to calm down their preoccupations and make them sure that it was not, let's say, a stigma towards them. We were not asking them to stay home, not going to work because they were foreign. It was actually was very common. They asked us in the last month. But it was something that everybody was, let's say, forced to do and respect. So this was a very important step we took in Italy. And in terms of prevention, this actually is the project I've been working the most in the last year. We decided to help also those facilities that were not medical per se. So, for example, this picture shows Casa Iannacci, that is the biggest dorm for the homeless in Milan. At the beginning of the pandemic, it hosted 600 people, of course, in different buildings. And now the number of guests has decreased to 250 more or less. This was done thanks to a lot of work of advocacy with the municipality, with the management of the dorm, and many other locations were found to host homeless people during the pandemic and keep them safe. And of course, it was important for social operators, social workers, to understand what measures could have been put in place to safeguard their staff, of course, and the hospitals and guests. And this model was also replicated, for example, in the residencies for the old people, who, of course, were pretty much hit by the outbreak. So it was very important to support these facilities, but also schools and detention centers. So we provided, let's say, advices, say, consultations, and a lot of training and information for the guests too. Finally, even if we are a medical organization, we have been asked also to do something about the social impact that COVID-19 had on the society and on the families, the so-called new poverty. Many people lost their jobs in the last months and could not provide at the same level, at least, for the families. So what we started to do was, at the beginning, starting in March last year, was providing, say, the normal shopping, going to the supermarket, for those who were the most vulnerable, so the elderly, or people suffering from particular diseases that could not go out, or people in quarantine and isolation. And then we developed a much bigger program that it's a food aid program, as you see in this picture, about boxes of basic items, mostly food, but also hygiene items, for example, for those families who cannot afford anymore to buy these essential items for the families. Thanks to all in all to these projects, of course, the biggest portion still represent our patients in our hospitals. You can see war and trauma, cardiac patients, pediatric patients, maternity patients. Of course, they still are our core target. But also last year, as I was said before, we added a couple of projects, new projects to support additional categories that have suffered this this pandemic. So all in all, we have been able to support 300,000 more or less people around the globe. And I'm done. Thank you.
Thank you for your words, for your explanation. If there are any questions for Ms. Francisca Lucchini, please raise your mute hand and we'll let you speak. So, Mr. Campadel.
Yeah, so we had a question. Following what happened in Italy, so if someone doesn't know, basically there was a doctor that was not vaccinated and he infected some of his patients. How do you think we could reconcile the individual's freedom of choice with the imperative necessity of vaccinating people for like healthcare in general?
Well, it's a very difficult question. I think most governments are asking the same question to the parliaments. Well, as a medical organization, we of course promote all the preventive measures, and we are actually advocating for developing countries to receive vaccines. Of course, as you know, the distribution of vaccines is not even right now in around the globe. Herd immunity does not require that everybody vaccinates, as you know. So of course, I cannot say you can force somebody to vaccinate. This is not democratic. This is not something that is foreseen in our constitutions and international law. Of course, considering the situation as a medical organization and as bearing a sense of responsibility, we normally promote vaccinations. But I don't think there could be anything to force people to do it. So abstention is a right. So I think it's. I think there is not much to say. Actually, it's government cannot force them. So unless they are an authoritarian government. So in our case, there should be a balance. Information, I think, is key to let people bring and take informed decisions and to decide how to take care of their